Well, just got some interesting news, which remind me to do this video. Our daughter, who gave birth to our first grandchild 6 months ago.
Yeah, just
So,
about.
yeah, about 6 months ago. She has changed her diet. She's trying to follow along what we're doing with me and eating a lot healthier. And she just sent her mother a text message that she's lost 11 pounds recently and doing the whole heart healthy eating thing. So as I sit here and enjoy the last little remnants of my healthy all-day fruit snack, I just want to share this with you. Results from the doctor's test, or at least blood test, that we had ordered before summer holidays. And it's all good news. We were looking at the correlation between MS and Lyme disease. So I had a Lyme disease test done, or sorry, a test for Lyme disease. And unfortunately I failed, or unfortunately, depends on how you look at it. But anyways, I did 2 tests. Anyways, and they both came back as nothing. So the way the doctor reports it, because I looked up online and it said that Lyme disease hides very easily, and it was more or less discussed that since it wasn't suspected that I had had a bite in the previous 4 weeks to having the blood work done, obviously not, because I was diagnosed with MS already last year, that the tests are pretty conclusive as far as Lyme disease, so no Lyme disease. Okay, the other things were for, I'm just looking, vitamin D, again, just a recap, vitamin B12 was okay. That was tested in the previous round of blood work, and it was on the okay high side of B12. So I think we dialed back a little bit on B12, yes?
Yeah.
Okay, so that's all good. Vitamin D, which is another huge thing for a lot of people. Everybody should really look into vitamin D and see the benefits of that. Anyways, I have a score of 199, and insufficiency is 25 to 75, whatever these numbers relate to or correlate to. I'm just letting you know. I was 199. A sufficiency is 76 to 250, and toxicity is 250 or greater. So at 199, I'm clearly on the high side of sufficiency, but not close to toxicity. So the vitamin D supplements are carrying on merrily, as well as the fresh fruit and vegetables. Of course, I'm going to be getting a ton of vitamin D out of that. And then the final thing was, which doesn't really pertain to the MS, but it was something that the doctor suggested anyways, was a prostate test. And I got good. So I was on the very, very low scale of between 0 to 2.5. I was a 0.34. So obviously it came back prostate specific as very, very low. So that's all good. Final thing, I'm just waiting for a stool sample test to come back. So haven't heard anything from that. That was a mail-in deal. So anyways, that looks really, really good, and obviously we're both happy that our daughter is carrying on with the healthy food program as well, and that she's losing weight, and our little granddaughter is as cute as a button. So right now on the health front, everything's good. And just real quick, I just want to mention, I was thinking today for some reason about my legs and how they used to bother me. And my legs been really, really good for probably the last month and a half, 2 months, probably since before our holidays. It's first weekend in September now, just after Labor Day. We started our holidays end of July, so yeah, since before then my legs have been fine, haven't shown any symptoms. So yeah, everything looks good so far. So healthy eating, and take care.